Good afternoon, everyone. Thanks for joining us. And as people are joining the live stream, I just want to say I hope everyone is being safe and doing well during this extraordinary time. And I know that the last year, I mean, it's hard to believe it's really been a year, has been such an incredibly challenging time for people. And I've even just today had meetings with healthcare workers, with small business owners, and others who I know are just really struggling. And so I just want people to know that, I hear you, I see you, we're working with you. We're going to continue to advocate in the legislature that people have the supports that you need. And so I just want to thank everyone for joining us today. I think one of the most important ways in which we can address this pandemic and do it in a way that's fair and just is to make sure that our workplaces are safe. And if we're going to get this virus under control, we have to make sure that we have the policies in place that those essential workers who are taking care of our loved ones and putting food on our tables and making sure our stores are stocked with essential goods, whether it's healthcare related goods or groceries, toilet paper, all those things that those workers are protected and have a safe place to go to work. And the more we do that, the faster we'll get this virus under control, and we can once again reopen our schools, our communities, and our economy. And so today I'm just really honored to be joined by a very strong advocate for workers. And so I just want to be able to introduce Deena Ladd, who is going to be joining me for this conversation today. And for over 20 years, Deena has been working to improve the wages and working conditions, primarily for racialized communities, women, low-wage workers, and immigrant workers, which, if many of you know, the outbreaks we saw on farms in particular last spring, and knowing that we're going to be having a number of migrant workers returning soon, just highlights, don't mean to interrupt your introduction, but it just really does highlight your important work in that regard. Deena's worked as a union organizer with garment workers, home-based workers, social service, retail, and manufacturing workers. She has developed and taught courses and training sessions for rank and file unionized women, young workers, and workers of color for various federations of labor, unions, and community organizations. And for the past 2 years, Deena has been working to build a membership-based worker center in Toronto that can improve wages and working conditions for many working people. The Workers Action Center works with predominantly low-wage immigrant workers and workers of color in precarious jobs that face discrimination, violation of their rights, and no benefits in the workplace. So, Deena, I just want to welcome you, want to welcome everybody online, and just say that stopping the spread of COVID is vital, and the Green Party has been really pushing the province hard for a safe workplace plan. And I'm just honored to have Deena here today to join us in that conversation. And so, Deena, I just wanted to really open and say that, from your experience in working with people through the Workers Action Center, what are you seeing right now in terms of workplace safety and the impact safety issue has had on workers during the pandemic? Oh, you're still on mute, Deena. The world we live in.
Yes,
all right,
yes.
Thank you.
Well, thank you, Mike, for having me. It's a really important conversation that we're having today, because I agree. I think that one of the biggest things that we can do during this pandemic is to support everybody to be able to go home at night and take care of their families and take care of their health. And this is really what this conversation is about making sure we all get to do that, regardless of the work that we do and who we are. So at the Workers Action Center, we run an emergency hotline every day for workers to phone about their problems at work. And as you can imagine, since the beginning of the pandemic, it's been nuts. We've had workers phoning us. I'd say sort of like there's a few big kind of things that kind of come to the surface in terms of issues that people are dealing with. One, um, you know, how can they not go to work if they're an essential worker
Right.
because they're immunocompromised or they're living with someone who is immunocompromised? Um, they can't go on a crowded TTC bus in order to go to work. And we know that many workers in the Greater Toronto area are having to get on at 6 o'clock in the morning on crowded buses en route. So it's not even just the workplaces, it's actually getting to the
Right.
workplace. Um, and so, and of course, the biggest issue is that when you're not able to work, how are you going to pay your bills? How do you try to sort of still take care of your family and be able to put a roof over your heads? Another big question has been my employer is not following public health guidelines around COVID-19. I remember getting calls from a food processing plant last year from a worker. Basically, the plant was, and this is in some places, they've gone from having one shift to two shifts to three shifts because the
Mm,
work that they do is in high demand, right? So, especially in food production, this is one of the biggest issues is that we've actually seen an intensification of work. And then not only that, but when there is a COVID outbreak, the employer doesn't want to shut down the plant. And so I remember getting a call from a worker last year who was basically saying that they had just been told that they were going to spray the plant while the workers were still there working, and they didn't want to even shut the plant down. And people were freaking out, going, what do we do? And I think one of the things that we've seen in this outbreak is that, you know, in essential jobs, in these kinds of essential jobs, workers are less likely to be unionized. And so people do not have the ability to speak up and to be able to say, you know, what are you doing? Like, you can't do this to us. You know, why are you not making sure that there's a full complement of cleaning staff? Why are you not making sure that we have PPE? Why are you not making sure that we have hand sanitization happening? So those are just I mean, these are just the tip of the
mm.
iceberg of kinds of issues that people are facing. A lot of fear, a lot of panic and stress about being infected, about what to do when infected, about how to protect oneself, how to be able to be able to not lose work, especially when there's such mass unemployment right now. So, you know, we've got a sort of a whole bunch of incredibly brutal ingredients right now in the labor market that are making it an incredibly stressful time for workers, whether they are essential workers and are having to go to work, or if they're in workplaces where they've been shut down since March last year and they won't be going back to work until, you know, potentially the fall, you know.
Yeah, and I think for a lot of those businesses that are or sectors that are shut down, uh, disproportionately are women who work in like hospitality sector
Mhm.
or personal care services, tourism, etc. And just maybe comment on two things. So one is just how important it is to have things like the CERB or a basic income to just provide people with their basic economic security while their workplace is closed down. And then related to that, for those whose workplace is open, there's been a lot of talk about the importance of paid sick days. So workers are not having to choose between going into work sick and possibly getting their, other workers sick as well. But then how am I going to have the income to be able to pay the rent and put food on the table and take care of my family? So maybe just if you could highlight the importance of both of those for workers.
Yeah, I mean, I think that that's the thing. We have to remember those workers who are at home and then those workers who have no choice but to go to work. Um, so paid sick days is, I think, a sort of an essential, to use that word, very important, an essential labor standard. And it has been shocking to see that the Ontario government has refused to implement this labor standard. Against all the research evidence, the guidelines, the recommendations from every medical officer from across Canada to Ontario to Toronto. And I'm not sure what it's going to take for this premier to wake up and understand that, he is not doing his job and he's not implementing paid sick days. So even before the pandemic became worldwide, back in February of last year, we were calling on the province to implement paid sick days. And I think essentially, and I think one of the reasons why there is so much support from the health workers community and from our medical officers is that they know that, when you wake up in the morning and you are not feeling well, and you've got a bit of a fever and your throat is sore, it is that moment that you have to make a decision about whether to go to work and whether to stay home. Now, that decision, if is just purely based on public health, you would stay home. However, that's not the decision you can make if what is at the back of your mind is that I don't know what this means. I don't know if I'm going to be off for 1 day, 2 days, 3 days, if I have COVID, or if this is just a bit of a cold or a flu. But what I do know is that if I don't go to work, I'm not going to be able to pay my bills at the end of the month. And for most of us, our primary concern is putting a roof over our heads and to take care of our families. And I think you can't argue with that, right? And
Mhm.
so what we're saying and what many um, you know uh, medical officers are saying is that in in order to stay home, a worker shouldn't be faced with a choice of whether it's your income and your wages and being able to take care of yourself or staying at home. That's not a choice. And so, what we need to do is we need to provide seamless and accessible access to paid sick days. And that is what the provincial government has the power to do. Now, what the provincial government is trying to do is to try to sort of put the responsibility on the federal government and to take no responsibility. And the federal program, which they keep talking about,
Mhm.
is meant for a very different thing. For a totally different purpose. You can only apply for that. You can only apply for that program after you've been sick and after you've sort of actually took the time off. You have to have lost 50% of your work that week in order to be eligible, and you have to have made $5,000 in order to apply for that program, as well as the fact that it could take 4 or 5 weeks for the benefit to come to you, and it's only $450 a week. So that works out to be about $12 an hour if you're thinking about it from an hourly perspective. So what we've seen is that and again, the evidence shows this, is that as infection rates have risen, the applications for this program have absolutely declined because people don't have the confidence that they're going to actually even get it. It's complicated to apply. You also need to find the application form. You need internet. You need all of these things, and then even then, you don't even know if you're going to get it. So we need to have the workers to have the confidence that they can still pay their bills and they can stay at home when they're sick. So we believe that there should be 7 permanent paid sick days all the time because, pre-pandemic, there was the flu. And as we know, our health workers say an average time that you're sick from the flu is at least 3 days to prevent infections, infectious disease. And so, and then during a pandemic, we believe that there should be 14 extra paid sick days to help you quarantine. And again, have seamless access. So that's the bill. I know that the Green Party is supporting Bill 239 that
right.
MPP Peggy Sattler introduced just before Christmas. And it's been amazing to see that now we have all oppositional parties' full support of that legislation. And now it is in the hands of the Ford government, and it's time for them to act. So you asked me the question about paid sick days, but then there's the issue of income supports. And it's incredibly important that we have income supports for workers who are in a range of jobs, ranging from full-time work to part-time, casual, temp, contract. And for many of the workers that we work with, they're often misclassified as independent contractors.
Yeah.
And so they're not even covered by basic labor legislation. So it was incredibly important to have income supports that could capture all of those employment relationships, basically, and to have established a base of $500 per week so that people could at least, minimally survive during this period of time. I think it's important to note that some of these benefits, including employment insurance for those who didn't have a huge number of hours when they first applied, they're all going to be running out in March, the third week of March, which is very scary. And we're already getting calls on our emergency hotline about how are people supposed to pay their bills? Because not only are sectors not reopening, but many businesses have gone down. They're no longer in operation. So your employer may have folded, or even if you have the ability to go back to work, you're working maybe 2 shifts a week, 10 hours, 15 hours. That is not going to be sufficient to be able to pay your bills. So there's a whole range of stresses coming up on workers, especially in March. And we're certainly organizing around that and wanting to ensure that things like the CRB, the Emergency Response to Canada Recovery Benefits, is extended to the end of the year, and that the caregiving benefit is extended to the end of the year, and that some folks who have not been able to get even access to it, like international students and those without valid social insurance numbers, can actually access it, because they're also jeopardizing their health right now and having to go to work with no other choice, which is
And I think
awful.
the important thing about that too, Dean, is that is even if you're incredibly self-centered, it affects you.
Yes.
I want to say to people, some of us obviously maybe think broader to society as a whole. Not everyone does, but even as an individual, knowing that you're not encountering people who are sick and could get you sick is really important. And I just want to, thanks for pointing out Bill 239. And I know I've been saying I'm ready to recall the legislature early. I would have gone back last week. I go back this week, whatever, and support a unanimous consent motion to have that pass. And whether, that's going to happen or not, doubtful given the words that the premier has said, but I think we have to keep pushing. And I wanted to ask you, so you've given a very compelling answer of why we need paid sick days and why we need basic income supports. Can you talk about some other policy measures that we need to have in place to make sure workplaces are safe?
Oh, there are many. I think it's important to remember that, we have a situation where precarious employment has been really exponentially growing in this country, and has really taken over the labor market by choices that employers are making to get more profit, but also governments that haven't actually done their thing to ensure that labor standards keep up to date. So, you know, in Ontario, our employment standards, so these are the basic labor laws that protect us, are mainly were mainly created after the Second World War, when work looked very different from what it looks like today. We didn't have temp agencies in the same way that we have now. You know, couriers and, you know, food delivery workers and personal support workers and all of these kinds of jobs that have become so precarious over the decades. And so there's been a huge push over the past 15 years to improve our labor standards so that the kinds of conditions that we saw in long-term care did not exist. And so we've been sounding the alarm bells to say, you know, it's not just about that precarious work, you know, is not great for workers. We know precarious work is not good for your health. And during the COVID-19 pandemic, this has been sort of exposed to
Mhm.
for people to fully understand what's happening. And so in long-term care, you see personal support workers not having full-time work, having part-time work, no benefits, um, health benefits, no paid sick days, working through temp agencies, very fearful of speaking out. All of those ingredients led to the disaster that we've seen. And we've seen the for-profit long-term care, you know, not have as a bottom line the care of patients, of the residents. It's been about making money. And so I think that the same ingredients that exist in long-term care are the same conditions that exist in warehousing and logistics in Peel, where we're seeing COVID outbreaks, in food processing factories, you know, in grocery stores where we know that, you know, 75 to 80% of workers who are grocery store workers are part-time workers. And because they're part-time workers, they don't have paid sick days and they don't get health benefits. And they are, for the majority, women. And in many of the jobs like cleaning and personal support, where conditions are really terrible, we're talking about women of color, racialized women who are in those jobs and who are the ones on the front lines and getting sick. So the government, the provincial government, has a whole host of decisions they can make. Getting rid of for-profit long-term care is one of them. Making sure that workers who grow our food, migrant workers, are protected by employment standards. I'm not sure if you know, but provincial labor laws apply to many workers except for farm workers.
Right.
They're not entitled to a minimum wage, limits on hours of work. They're not entitled to a daily rest period, time off between shifts, overtime, public holidays. And so we've seen through this pandemic the incredible number of infections on farms in our province, and where we've now seen 3 farm workers die from COVID-19, which, you know, is horrendous. I think that we need to tackle precarious employment. We need to improve our labor standards. We need workplaces to, we can't just care about workplaces during a pandemic. We have to sort of show that we care about the health of workers all the time, and that it's critical that workers are able to go to work and take care of themselves and not be injured, not face infectious diseases, and not have their health compromised by poor working conditions. So there's a whole slew of labor standards that could be improved, such as obviously paid sick days, making sure migrant farm workers have full access to employment standards, ensuring that we don't have this, that part-time workers are able to be offered hours before an employer hires more part-time workers. So that would kind of get rid of this kind of, you know, having 85% of your workplace is part-time and then nobody making enough money, right? We need proper health benefits for workers. Those are just a few of the things. Equal pay for equal work, so that, again, this is shown in long-term care. You've got women working in long-term care who may be just called part-time, but they've been working there for 20 years, but they get less per hour than a full-time worker. Even though they've been there for the same time and they're doing the same job, but because I'm called part-time, I get $2 less. We have to deal with the fundamental issue of poverty wages. We're still at $14.25 as the minimum wage. We have sub-minimum wages for liquor servers and students, which is not right. So there are many things that we can do to ensure that we try to start to deal with some of the systemic issues that face workers at work.
Yeah, one of the things that I've been thinking a lot about is for folks who keep saying, let's open the economy, let's open the economy. And I keep thinking, well, if we had safe workplaces and we weren't having outbreaks in warehouses and food processing and long-term care homes and places like this, we actually could have the economy open, which is, one of the things I find so ironic about the situation we're in. And I think one of the things you talked about that was so important is that when you wake up in the morning and you have to make that immediate decision, and especially in relation to paid sick days, but I'm even thinking just knowing that your workplace isn't safe, and then not being in a position to say, I'm going to refuse to work in an unsafe workplace, and sort of what that does to a worker's mental health. What does it do to, potentially spread COVID? What are the wider societal implications of a person not being able to say no to an unsafe workplace?
Yeah, I mean, I think that's the dilemma that faces so many people every day. Like, we now know that, more than a majority, 65% just even the Greater Toronto area is essential workers. And so this is that dilemma that you're talking about is the dilemma that so many people face all the time. And I think that we need to know that our labor standards are very weak. And right now in our labor standards, our basic labor standards, we do not have an employer can get rid of you with no reason at all. We don't have just cause protection. Right now, the Conservative government also has taken away the ability for workers to complain for constructive dismissal. So if you were a worker that is returning back to work, but your hours have substantially changed and they've reduced your wages, there's nothing you can do about it. We also need robust inspections, right? We have a Ministry of Labor that has the ability, has the power, have the tools in the legislation to do robust inspections, proactive, surprise inspections, and levy serious fines, including prosecution and jail times. We're not seeing them use that. In fact, when the Toronto Star reporter Sarah Mojahzada investigated the inspections of last year from March until December, only one employer was fined through proactive inspections. One employer. So we know that there's definitely more that's going on there. So the Ministry of Labor needs to use the tools that they have at their disposal to protect workers and to ensure that employers know that there will be severe penalties if they break the law. But we also need to ensure that workers have the ability to speak out, to be able to speak without fear of losing their jobs. Because once you are afraid of losing your job, again, you're faced with that choice, right? Of, am I going to lose my job if I speak out against this huge abuse that's taking place? Because if I am, I can't afford to do that, right? And so I think that's why we see such a high rate of violations happening in workplaces. high rates of injuries happening, especially when employers are also using temporary agencies as a vehicle to hire workers. We know that workers who have two employers, temp agencies and client companies, are not going to speak out. It's proven, it's research report after research report that shows that. And so we really need to deal with some of these systemic inequities and weak labor laws that we have.
Yeah, I would, we're coming up to the end of our time here, and we could carry on this conversation for probably another hour or longer, because I'd love to maybe have you back sometime to talk about the gig economy, precarious work, etc. But I want to close a little bit with just, obviously there's a lot of anxiety around vaccines. The availability of vaccines obviously is a big concern, but the rollout of the vaccine plan as well. And just maybe some thoughts from you on the disproportionate burden that essential workers have faced in terms of exposure to COVID, especially those who are women and come from racialized communities, which we've certainly seen in Peel, but in other places as well. So just your thoughts on vaccine access for essential workers and workers in precarious positions, especially those from racialized communities.
Yeah, I mean, I think that, we've also seen huge outbreaks in Scarborough as well with
That's right.
the
Yes.
kinds of infections that we're seeing. And we've had incredible advocates like Dr. Lisa Salaman speaking out about this, which has been really fantastic. And I think one of the big conversations is about equitable distribution, and that doesn't mean sort of having an equity framework in understanding that those that are more susceptible to being infected and are more vulnerable because they don't have paid sick days, they don't have health benefits, they don't have they are living in communities where housing is more dense, they don't get to stay at home. All of those things should be playing a factor in how vaccinations roll out. I mean, obviously, there is an incredible priority of long-term care and any health facility, but then we need to be looking at, prisons as well. I mean, we're seeing massive outbreaks in prisons as well, where there's no ability for folks to be able to be socially distanced, and the kinds of crowding that's happening. And so absolutely, I think that I'm looking for, and I think a lot of us are looking for, the racialized communities, low wage communities, people living in poverty, people who don't have the ability to follow public health guidelines because, frankly, of income and of poverty, that they should be prioritized. And, those of us who get to stay home and socially distance and only go out when we get groceries, we should be last down the line if we're not immunocompromised. And so I think that, I think that is really quite critical right now as to advocate for that as this rolls out.
Yeah, thank you so much for joining us today. And also I want to just say how much I admire your tireless advocacy for workers. And
thank you, Mike.
And so I hope we can have this conversation again. And I look forward to the day when the public can return to Queen's Park, because I know a voice like yours is needed in Queen's Park. And so I'm hoping that we have an opportunity to meet and talk in the halls of Queen's Park sometime soon as well. So
well,
thanks
thank
for
you
joining
so
us.
much.
Yeah.
Well, thank you so much for supporting the paid sick day legislation. It's really fantastic to see the Green Party standing side by side with us fighting for this. It's really quite critical right now. So thanks for your leadership.
Thank you. And thanks everyone for tuning in on this really important conversation. And I just want to ask everyone, please be safe, wear your mask, stay home if you can. And if you go out, make sure to respect public health guidelines and be well and be safe, and take care until next time. Bye for now.